A lot of people today aspire a toned and sculpted body. What is important is meticulous planning and choosing the right plastic surgeon if you're thinking of this procedure. Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Cosmetic Clinic, Saket. Depending upon the need of the patient, a body sculpting procedure can involve a lot of procedures. So when we're talking of body sculpting, we could include a liposuction, which is the commonest, a body lift, which is involving the entire body, a thigh lift for the thighs, an arm lift for the arms, a tummy tuck, or in fact an extended tummy tuck or a belt lipectomy. Which procedure is required by which patient is going to be discussed in a consult with the plastic surgeon. So what are the factors which a patient needs to consider when he or she is planning for a body contouring procedure? First and most important is choosing the right plastic surgeon. So who is a right plastic surgeon? Number one, a person who has an adequate experience and the right degree. So it should be a board certified plastic surgeon with a degree in plastic surgery. So not every cosmetologist out there or every surgeon out there is the right person to do such a complicated surgery. Second is the infrastructure. You need to have a place where you have all the equipment in place, you have all the emergency medications, you have a good anesthesia setup and a good team to take care of the patient during and after the surgery. So these are the two most important things when you're looking for a procedure like a body contouring. You should also think of the patient factors which are important in this kind of a procedure. So I'll enumerate some precautions which a patient needs to keep in mind if she's looking for a body contouring procedure. Number one is your weight. So whenever you're thinking of a body contouring, you should not be grossly obese. So you have to have a BMI which is below 35 if you're looking for a body contouring procedure. It's ideally meant for a patient who is close to the ideal weight and has lost a good amount of weight and is now uncomfortable with the excess loose saggy skin present in various body parts. So anybody who's obese first needs to shed all those extra pounds before contemplating a body contouring surgery. Number two is your diet. So you should not be on certain supplements or certain products which can increase bleeding. So these include herbal supplements. These also include things like vitamin E, which is very popular. I would say supplements like green tea in fact can also cause a lot of increased bleeding in the post-operative period. So essentially, as a blanket rule, we ask the patient to be off supplements for a period of at least 2 to 3 weeks prior to a major surgery and also continue the same for a period of at least 2 weeks after the surgery. The third thing to consider is if you're on any substance. So if you're taking an occasional glass of wine, that's fine, but if you consume alcohol on a regular basis or you smoke on a regular basis, then that also needs to be stopped for a period of 2 to 3 weeks pre and 2 to 3 weeks post surgery. This is of utmost importance because these substances can affect the healing process to a great extent. So what would actually heal in 2 weeks might heal in something like a month if the patient is a chronic smoker. So this is again something which we repeatedly emphasize, that you have to give up alcohol and smoking for the requisite period before such a major surgery. The fourth point is obviously the pre-anesthetic assessment. So whenever we are taking in a person for a body contouring surgery, say a tummy tuck or a breast reduction or a breast lift, we need to get a complete array of tests. So this would include your blood work, which would be told to you by your plastic surgeon. We would also require investigations like a chest x-ray, especially these days in view of the COVID scenario. So some people do have long-standing breathing issues following COVID. We also need an ECG, and in some specific cases like if you're doing a breast reduction or a breast lift, we would also require a mammogram as a baseline investigation. So all these tests need to be performed, and once you have the results, we're going to run them through our anesthetist, and only when we get a green signal from him or her, we would be ready to take you up for the surgery. So you have to be fit as a fiddle before planning this kind of a surgery. Number four is your diet and exercise after the surgery. So the surgery is going to help you to get back into shape, but to maintain that shape, you need to know that, okay, I'm going to have this kind of an exercise regime, this kind of a diet regime pre-planned before you're thinking of such a procedure. So if you want long-lasting results, do have a diet and exercise schedule ready, which you would go back to, say, about a period of 3 to 4 weeks after your surgery. That's really, really important. A specific subset of the population who requires these procedures is usually a woman after pregnancy and childbirth. So here I would like to emphasize that go in for this surgery once you think that your child is old enough and can be left in somebody else's care for at least a week's time, or you have adequate help at home to help you tide over the immediate post-procedure process. Also, if you're a working woman or a working man, you have to ensure that you have an adequate period of rest. Don't try to rush back into your work schedules, and give your body at least 2 to 4 weeks depending upon the type of procedure you've undergone. Last but not the least, it's very important to kind of space out these procedures. Don't do everything at one go and have realistic expectations from the outcomes. If you found this video useful, please share it with your friends and family, and please like our Facebook page.